Hello, everybody. Dr. Lonnie Stewart here from the Healthcare Education Transformation Podcast. Are you a physical therapy student about to start studying for the National Physical Therapy Examination? Or maybe you're a professor, a program director, or clinical instructor who teaches DPT students preparing for the NPTE? Either way, we would recommend checking out our sponsor, NPTE Final Frontier, and the community they've built around preparing for and succeeding on the NPTE. That exam and the preparation that goes along with it can be long, tedious, difficult, and stress inducing, but it doesn't have to be. NPTE Final Frontier has the tactics and resources to help address all of the usual barriers. They even have scholarships to help with NPTE study courses, FSBPT registration fees, and even research opportunities. And if that's not enough, they're even donating to the very first annual HET Podcast Scholarship to be awarded at the end of every year. Go to npteff.com for all of the details and use code HET for 10% off all purchases. Links to both the NPTE Final Frontier and their scholarship options are available in the show notes. And now, let's get ready to learn.
Hello, everybody, and welcome to another Teach Me Something Tuesday episode. I'm your host, Dr. F. Scott Feil, and today's episode is all about doing your research. Now, this doesn't mean doing research for scientific purposes or submissions to review journals or any sort of research presentation, but instead, this is all about research for you and your possible job and or position. And so this can go for those that are going into the clinical world. This can go for those that are going into academia. But really, one of the things you want to do before accepting a new position is your due diligence. One of the things that you can do is asking colleagues or people that work at the place you're looking at what they can expect of the patient population there or the student population there or the coworkers there. Ask people there what you wish you knew before coming here, right? The things that maybe that you don't think about or that aren't talked about too much during the interview and kind of honeymoon phase, right? You can definitely ask about any sort of helpful insights or tips or tricks, or just anything in general that what's working, what's not, pointers, tales from the inside, right? Things that you can really use to make a well-informed decision. So let's take it from a clinical aspect. After you've had your interview, maybe you've toured the facility, you're heading out, and they invite you back for another either interview or they give you the position and ask if you're ready to accept. Don't be afraid to ask if you can shadow one of the team members for a little while one day or get to know somebody on the team already and just ask them those questions. Ask them what tips they have, tricks, pointers, any sort of things that may help you make your decision, things that they wish they had known or asked. Just, ask them to have conversations about the workflow in the workplace because those can help you make decisions. Now, if we kind of talk about the academic side of things, right? You can ask your colleagues, especially if you're teaching as a lab assist or an adjunct or contributing faculty, you're already kind of in the system. You can ask them about the student population at the university XYZ. What are the students like? What is the overall vibe and the flow of each cohort, the overall student population? You can ask about helpful insights about teaching a specific course. Maybe if somebody else is already teaching it or has taught it in the past, you can kind of learn from them and have them teach and educate and mentor you on those courses that you're going to be taking over. And again, really just asking what they wish they would have known before they taught their own course for the first time. Just anything about your specific course that you're going to teach, but also learning about just teaching in general, because that's one of the things that took me a little while to realize was it really took a flow and a personal teaching style. And that didn't happen overnight. That probably took me about 2 years to finally get into when it came to flow. But asking people and just asking for help, asking for guidance, mentorship, and just advice and input really helped with making decisions on how to do things, where to go, what to do, how to look at things differently and what to consider. It was super helpful. So make sure you do your research and your due diligence before taking a new position. Hope that helped, and we will see you on the next one. Well, I hope that episode was entertaining as much as it was informational and educational. If you enjoyed this episode or any of our past episodes, We ask you to please subscribe to the podcast and leave us a rating and review. And please share out the episodes to those who you feel may be able to benefit from them. We also urge you to follow us on all social media platforms at HET Podcast and let us know what topics or experts you would like to hear from in future episodes. And just as a reminder, none of the information on today's show should be considered medical advice. It's simply infotainment or edutainment to help educate our audience. For medical advice, we always advise you to reach out to your preferred medical professionals, and we'll see you on the next show.